Have you ever used sleeping pills like Zolpidem or benzodiazepines? These medications are strong sleep aids that requires a doctor's prescriptions because they have a powerful effect on the central nervous system and are considered psychotropic drugs. This means they need to be carefully managed by healthcare professionals in hospitals and pharmacies. But do you need to rely on these prescription medication to deal with insomnia? Not necessarily. There are over-the-counter sleep aids available at pharmacies that are different from prescription sleeping pills. These non-prescription sleep inducers are easily to get and are considered safer, which is why people of all ages often use them. Antihistamine drugs like diphenhydramines and doxylamine are commonly used to treat symptoms of cold, allergies, and runny noses. These drugs are also found in many cold and allergy medications. One of the side effects of antihistamines is drowsiness, which is why you might feel sleepy after taking them. In fact, this drowsy effect leads to the development of sleep-inducing drugs based on these antihistamines. So, how do they help us fall asleep? Antihistamines works in the brain, particularly in the cerebral cortex. Normally, a substance in our body called histamine helps keep us awake and alert. Antihistamines block the action of histamines, making it easier to fall asleep. Since these sleep-inducing drugs take some time to work, it's best to take them about 30 minutes to an hour before go to bed. However, like all medication, these sleep-inducing drugs can have side effects. It's important to be careful with them because it is easy to take them too often or in higher doses than needed. Let's take a closer look at what those side effects might be. When you take sleep-inducing drugs like diphenhydramines or doxylamines, you might still feel sleepy even after waking up. This happens because these drugs stays in your system for a long time, about 9 hours for diphenhydramines and 10 to 12 hours for doxylamines. Because of this, the effect of the drug can last into the next day, potentially make you feel drowsy during the day. Now, feeling sleepy during the day might not seem like a big deal compared to the pain of not being able to sleep at night. However, if these drugs make you sluggish in the morning, you might not use up your energy as you normally would. This can lead to trouble sleeping at night because you are not as tired as you should be, causing you to take the sleep-inducing drug again. This creates a cycle where you depend more and more on these drugs, which can lead to needing stronger medication or facing serious side effects. That's why it's important to understand how to properly use sleep-inducing drugs and be aware of their side effects. Although sleep-inducing drugs are generally considered easy to get and safe, they can cause side effects if not used correctly. One of the main concerns is their anticholinergic side effect, which can lead to issues like constipation, dry mouth, difficulty urinating, a rapid heartbeat, and even glaucoma. Anticholinergic drugs, like some antihistamines, block the parasympathetic nerves in our body. These nerves control the smooth muscle in areas like the digestive system, urinary tract, and eye. When these nerves are blocked, it can cause your pupil to dilate, increasing the risk of glaucoma. It can also slow down digestion, leading to nausea and constipation. Because of these side effects, certain people should avoid these sleeping-inducing drugs. For example, people with urinary tract blockage, asthma, or an enlarged prostate should not take them, as they can worsen these conditions. For older adults, sleep-inducing drugs can be particularly harmful. As people age, their bodies process medications more slowly, which means the side effects like dizziness or confusion can last longer. This increases the risk of falls and other accidents, especially because older adults have slow metabolism. The hangover effect from this drug can extend into the next day, making this risk even higher. In addition to this immediate risk, research have shown a potential link between long-term use of certain sleep-inducing drugs and an increased risk of dementia. A study conducted by the University of Washington followed 3,400 people aged 65 or older who were initially free of dementia symptoms for an average of 7.4 years. The study found that those who take diphenhydramine for more than 3 years had a 54% higher risk of developing dementia compared to those who did not use the medications. This is because antihistamines can block the action of anti-acetylcholine, a neurotransmitter in the brain that is important for memory and cognitive functions. The study suggests that long-term use of first-generation antihistamines can increase the risk of dementia, particularly in older adults or those already at high risk. However, second-generation antihistamines are thought to carry a low risk. To reduce the chance of cognitive decline, it's important to consult with healthcare professional before using antihistamines for an extended period, especially the first generation one. How to safely use sleep-inducing drugs. Diphenhydramine is often recommended as the first option for a sleep aid because it has a shorter half-life than doxylamine, which means it's less likely to cause lingering drowsiness the next day. The recommended dose is usually 25 mg, which is effective for most people. If 25 mg doesn't work for you, you can either increase the dose or consider switching to doxylamine. Antihistamine-based sleep aids were originally intended for short-term use, typically up to 2 weeks. Using this medication for longer than 2 weeks or making it a habit can lead to side effects like those mentioned earlier. So it's important to be cautious. The 2 weeks limit is recommended to prevent your body from developing a tolerance to the medication, which can reduce its effectiveness. Over time, you might need a higher dose to achieve the same effect. The FDA advises against using this over-the-counter sleep aid for more than 2 weeks, and it's important to follow this guidance.